We're back with an update on the Philips Respironics recall. Are you one of those patients that's affected by this recall and you're waiting for a replacement machine or at least a fix to the machine that you currently have? We have an update for you. First off, let me say things are moving along. We're getting an update from the FDA and we're getting an update from Philips Respironics themselves. So this is something that you want to stay through the whole video so you catch every piece of information. This information that I'm going to be reading to you, I got directly off the FDA's website, and I'll be linking it in the links below. On September 10th, the FDA initiated an on-site inspection of Philips Respironics manufacturing facilities to assess compliance and regulatory requirements. In addition, they updated the frequently asked questions on CPAP and BIPAPs. We'll also link it down below so that you can see all the answers to the questions. The FDA reviewed and concurred Philips Respironics plan for recall Dreamstation CPAP and BiPAP machines, specifically Dreamstation CPAP Pro Auto, all configurations, Dreamstation Bipap Pro Auto, all configurations, and Dreamstation ST, ASV, Avaps, all configurations. Now, we've all been seeing all these updates and different sources telling us that Philips Respironics is going to be completing this recall within 12 months. We don't know if the 12 months is from the first time in July 14th when they reported the recall, if it's from September 1st, or if it's from today, September 28th. This is something that Philips Respironics needs to give us a clear update so that we know when this recall is going to be completely done. Now, going back to the FDA's website, the FDA is committed to using every tool at our disposal to increase the availability of medical products. The FDA is working with Philips Respironics to monitor the repair and replacement of impacted devices expeditiously. They're also collaborating with other manufacturers and the government to make sure that there's availability for these CPAPs and BiPAPs. Now, that puts me on to the next part of this update from the FDA. The FDA has also now announced, due to the shortages of all chips and things due to COVID-19, they have added the CPAP and BiPAPs to the list of shortage in medical devices. Philips Respironics has not yet provided the FDA with all the information needed for the FDA to evaluate the plan to repair and replace products across the Philips Respironics recalled devices, including the Trilogy ventilators, A-Series BiPAP machines, C-Series BiPAP machines, OmniLab Advanced Plus, Garbin Plus, Aries, LifeVent, E30 ventilator, Remstar SE Auto, and the E30. Those are the devices that the plan has not been approved for yet. For the Philips Respironics Dreamstation, the plan has been approved so that Philips Respironics can either replace the machine or rework the machine and make sure that they correct the issue. Just to reiterate, remember that this FDA update was from September 10th. This concludes the FDA's update, and now we are going to be going to the Philips Respironics update. This update from Philips Respironics comes on September 20th. To our valued customers, as part of a commitment and to be transparent and frequent communication regarding the June 14, 2021 recall of certain products in our sleep and respiratory care portfolio, I wanted to take this opportunity to share some important updates with you. Over the last several weeks, our team has been working to accelerate actions needed to complete this recall. While the progress cannot happen quickly as well as I would like, we are making important progress. I want to share this with you, some of the steps that will be taken in recent weeks. Patient registration, we're going to be linking down below. I'm not going to be reading that section, but make sure if you have not yet registered your Philips Respironics device to click on the link down below, follow the steps, and register your device. We have begun shipping replacement devices, Dreamstation 2 units from our accumulated inventory direct to patients and to DMEs who have elected to manage the replacement process. With this important first step, our commitment to you is refining and improving the process based on the lessons learned from these shipments. We are pleased to announce that on September 1st, that we have the authorization from the U.S. Food and Drug Administration for the rework of the affected first generation Dreamstation devices in the United States. Rework is starting this week, and we have built thousands of repair kits for the first generation Dreamstation in the effort to gain momentum with the rework process. It is through an active rework and replacement program that this remediation will gain speed, and we will continue to target a goal of completing all the recall in approximately 12 months. Again, we say 12 months, but we don't know the date. This This letter was issued September 20th. Philips remains in dialogue with the FDA with respect to other aspects of the recall notification, including authorization for the rework of other systems such as the Trilogy 100/200 and the OmniLab. We continue to prepare so we can move in the speed of remediation. Now, if you see, they're telling us they already got the authorization from the FDA to rework the Dreamstation 1. So they're already building repair kits and they're already starting the process. Just as well as replacement machines, we've already seen few patients that have already received the replacement machine. Philips Respironics has increased and ramped up their manufacturing process. As you know, we have redirected our manufacturing capacity to focus on addressing the needs of the recall on global scale. This includes increasing the production of new Dreamstation 2 devices. As a result, we have increased the global production capacity of repair kits and replacement devices in Q3 of 2021 to 55,000 units per week. We aim to increase capacity to 80,000 units per week in the Q4 of 2021. This accelerates the production scale, includes a high volume of support needed for the recall of the devices and impacted by the recall. Now, the last part of the update is talking about the patient communication. Patient communication is how Respironics is notifying their patients of this recall. In the very beginning, Philips Respironics let all their DME suppliers know, and the DME suppliers were reaching out to patients. We have also seen some ads from Philips Respironics stating about the recall, and they're putting ads in social media as well as other sources. Through these tough times where we can't find replacement machines, I understand you might be looking for one, you're trying to maybe buy one out of pocket and you can't find one. This is something that you need to stay calm and not panic. Machines are going to be little by little becoming available. If you have the capacity to be able to purchase one out of pocket and you're able to get one, I would recommend to do so. This process might take, like they say, 12 months, but 12 months from what date? Nobody knows yet. Philips Respironics has not given a precise answer. One thing we are pleased with is that we are seeing some updates from the FDA and from Philips Respironics so that we know that this process is moving forward. I understand that a lot of you are panicking and are very frustrated with this process, but you got to understand that now things have to be crystal clear, and the FDA is going to be really hard on Philips Respironics for the meanwhile to make sure that they get things done in the right manner. Thank you for watching this video. My name is Ozzy. I'm the respiratory therapist with sleepplay.com. If you liked the video, please like. If you have any questions or comments, please comment down below and we'll be sure to get back to you as soon as possible. Make sure to check out our social media pages, Instagram, Facebook, and of course, subscribe on YouTube. Hit that notification bell so you get all the updates. Thank you.